So I would present and communicate professionally. I'm going to check my provider orders. Looks like we have an order to do some patient education on some post-operative exercises. So I'm going to gather my necessary tools. So I've got my stethoscope, I've got my napkin for the coughing exercises, and I've got my incentive spirometer. So I'm going to go ahead and go to the patient room. So knock, knock. Hi, I'm Markel. I'll be your student nurse today. I go by he, him pronouns. Can you go ahead and confirm your name and date of birth for me?
Yeah, Danny Ramon, 0209-1990.
Great. And do you have any preferred pronouns?
He, him is fine.
Awesome. Do you have any allergies that I need to know about?
No.
No? Great. So let's provide for patient privacy. So what we're going to be doing today is I'm going to be showing you how to do some post-operative exercises. So we're going to be going over some deep breathing exercises, some coughing exercises, be doing some leg exercises, and then I'll show you how to use an incentive spirometer. Does that sound okay?
Yeah.
All right, ready to get started?
Yes.
Great. So we would begin with a pre-assessment. We would make note of any history of emphysema, chronic bronchitis, asthma, smoking history, if the patient is pregnant. We would also check their hemoglobin levels, and we would note if they've had any recent abdominal or thoracic surgeries, okay? So with that out of the way, I'm gonna go ahead and take a listen to your lungs. And then if this were a real patient, I of course would auscultate underneath the gown, but I'm just gonna go ahead and auscultate over the scrubs for the purpose of demonstration. So each time you feel this on you, just take a deep breath for me. Good. Can you go ahead and sit up? Good. Excellent. Lung sounds clear to auscultation, bilaterally. I'm going to go ahead and take a look at your legs. That's okay. I'm going to pull these up. And I'm checking for signs of thrombus. So I'm looking for any redness. There's no visible signs of redness, no visible signs of swelling. Checking for warmth. Is any of this painful or tender as I palpate?
No.
Good, so no pain or tenderness, and the calves are generally symmetric. Excellent. I'm going to go ahead and check your pedal pulses while I'm down here, so excuse me. Good. Pedal pulses are +2 bilaterally.
Thank you.
Excellent. Okay. So, and then I just want to assess your ability to cough. So is it okay if I place my hand on your abdomen? Okay. Take a deep breath for me. Great. Go ahead and grab that tissue. And now take a deep breath, but on the exhale, I want you to cough it out, okay?
Okay.
Go ahead. Excellent. Was any of that painful?
No.
Great. Okay. So for our first exercise, so I'm just going to demonstrate, and then I'll have you go, okay? So for the first exercise, we're going to be doing some diaphragmatic breathing. So we're going to take the tips of our middle fingers, place them together like so, and then we're going to take our hands and place them at the bottom of our rib cage. And we really want to only use our abdominal muscles when we breathe in for this exercise. So we want to avoid using our shoulder or our chest muscles. So I'm going to breathe in through my nose, hold for 3 seconds, 3, 2, 1, and then exhale through my mouth. Excellent, doing pursed lip breathing like I'm blowing out a candle. Okay, can you go ahead and demonstrate for me? Good, excellent. And then we would have the patient do this 3 to 5 times just to confirm understanding. And we would just ask that after your surgery that you would do that about 10 times per hour while you're awake, just to help with your lung recovery, okay? So for the next one, we're gonna do some coughing exercises, all right? So we just learned how to do the diaphragmatic breathing. So I want you to do that for me 2 times. So go ahead. So in through your nose. Good. Hold for 3. Excellent. One more time. Excellent. Now I'm going to hand you this tissue. Now on this third one, on the exhale, instead of breathing out, I want you to cough it all the way through, okay? So go ahead. Good, good. Any pain?
No.
Good. Okay. Then again, this is another one of those exercises that we would have you do about 10 times during waking hours, 10 times an hour while you're awake, just to help with your lung recovery. Okay? And if it's post-surgery and you've had an abdomen surgery, what we would have you do is we would have you splint the incision site, okay? So we would take a pillow like so, and you just press firmly on it, and you would do your exercises. You would breathe in like normal, and then when you cough, you would use one hand to cover your mouth with the tissue, and then use the other one to hold the pillow there firmly. So you can go ahead and demonstrate that for me. Excellent. Very good. All right. Okay. So now we'll move on, and I will show you how to do the incentive spirometer, okay? Oh, actually, before we move on, so when you're coughing into the tissue, take note of any sputum. If you see any sputum, note the color, if it has any odor, how much of it, and then you're gonna note any changes to that sputum over time, okay? And if you notice any changes, just go ahead and let me know, all right?
Mm-hmm.
All right, so now on to the incentive spirometer. So here's our incentive spirometer. And you can go ahead and grab your mouthpiece. So I've got my mouthpiece for demonstration. So this is the incentive spirometer. You'll notice the mouthpiece connects to a flexible tube. And then you'll see this piston and this marker here. And this marker, for our purposes today, is set at 1,000. And so what you're gonna do is you're gonna let out your breath. You're gonna place your lips around this mouthpiece, and then you're gonna inhale. And as you inhale, you'll notice this piston move. And your goal is to get it up to that marker, so to that 1,000 range. And then hold it there for 5 seconds. 4, 3, 2, 1, and then exhale. So it should look something like this. Ready? Make sense?
Mm-hmm.
Okay, your turn. Good. All right. And then again, this is another one of those exercises that we would ask you to do about 10 times while you're awake, post-operatively, just to help you, that's going to help you prevent pneumonia and keep your lung capacity up and help you with your lung recovery, okay? So before we move on to the next set of exercises, I just want to reassess your respiratory function, okay? So I'm going to make note of regular rate and rhythm, regular depth of breathing, and I'm going to go ahead and take another listen to your lungs, okay? So again, I'm just going to go ahead and auscultate over the scrubs for demonstration purposes, but in a real situation, we would go underneath the gown. So when you feel this, just go ahead and take a deep breath. Good. Good. Sit forward for me. Excellent. Lung sounds clear to auscultation, and oxygenation is within normal limits. Okay. So we're going to go ahead and move on to the last set of exercises. And for the last set of exercises, I'm going to go ahead and have you lay flat.
Sorry.
Okay. And if you can just relax and give me total control. Okay. So I'm going to grab your toes. And for this first exercise, what we want you to do is we want you to move your toes in a circle. Right? We're going to move them in a circle just like so, and then go the opposite direction. Okay, can you demonstrate that for me? Okay, other way. Good, good. And then for the next one, we're just gonna, again, just let me have control. You're gonna take your feet and move them back toward your shins, and then point them down, right? And then move them back toward your shins, and point them down. Good. Can you demonstrate? Back toward the shin, point them down. Excellent, excellent. Okay. I'm going to place my hand on your thigh, okay? So, for this exercise, we want you to straighten your leg out as much as possible while driving the bottom of your knee into the mattress. Okay, go ahead. Good job. All right, one more time. Good. Can you do the other leg? Excellent. Great. And then can you do it on your own? Excellent. Good. Okay. Now, for the last exercise, for the last one on this set of exercises, again, just let me have control. We want you to straighten your leg out, and then we want you to bend and bring it back toward the body. Straighten it out, bend, bring it back toward the body. Okay? Can you demonstrate that for me? Good. Other leg. Excellent. Okay. And then again, so this is just one of those exercises. We would ask you to do that set of leg exercises about 5 times an hour while you're awake, or as much as you can tolerate it. And again, so all the exercises we've gone through today are just to keep you somewhat mobile until we can get you up and out of the bed, okay, and to aid in your recovery. All right. Any questions about any of that?
No, I'm good.
All right. So that concludes our post-operative exercises education. So with that, I would lower the bed down to its lowest level, put the patient back in a comfortable position, lock the wheels. I would make sure that the call light is within reach. I would make sure that the table is within reach. And then I would go ahead and hand hygiene out and go document. Thank you.